Now to a continuing crisis all over our state, the growing need for mental health treatment programs. 5 Investigates has reported extensively on services that are struggling to stay open. Some have even closed.
Patient advocates and providers are now warning that care will become even harder to find. Investigative reporter Kirsten Swanson is live at the Capitol tonight to explain why. Kirsten.
Hey guys, so most of these programs rely on reimbursements from medical assistants, and those rates are set by the legislature here. But earlier this month, lawmakers in the House cut portions of a bill that would have significantly increased those rates and therefore the funding that these programs receive. Advocates tell me that families are now left to pay the price. These file folders laid out in front of Pat and Karen are just a fraction of the hundreds of documents.
Oh, it would be stacks and stacks
that document their fight to help their daughter.
It was like 6 years ago, all of a sudden she changed. I'm sorry. You know, when we look at pictures and she's hugging and she's smiling, and she went from that to just complete opposite.
The 14-year-old's mental health needs are so complex. The family has struggled to find a treatment program in Minnesota that can stabilize her.
She's been to the ER over a dozen times. She's been in crisis respite twice, and she's been in an inpatient hospitalization again. So it's just kind of this rinse and repeat cycle over and over again.
Those programs, as 5 Investigates has previously reported, are struggling themselves. Increased demand, coupled with low reimbursement rates and a lack of workers, are forcing intensive treatment programs out of business.
And there's not one of them who's ever said, yeah, this is a great system. Everything's working the way it should. They all acknowledge that it's a broken system.
Many hoped the legislature would tackle critical funding issues this session. In January, the Department of Human Services released this long-awaited study that showed Minnesota's medical assistance reimbursement rates are far below market demands. Providers say, on average, the gap between what it costs to do business and what they receive in reimbursement is nearly 40%.
We're not meeting the need. We are not meeting the need.
But despite the state's own research, lawmakers in the House took those rate reforms off the table earlier this month.
The bill has a lot of really, really good provisions in it. We just can't afford to do some of them.
During a recent hearing, representatives clashed over the cuts.
We had an unaffordable, irresponsible $30 billion budget last year. And that is what means that we do not have adequate funding now to fund these essential services.
When you have to put together the budget, you never meet all the needs. You always feel like there are people that you're disappointing, and more importantly, that you're leaving their needs, their critical needs, unmet. This is just part of our job, folks.
Pat and Karen worry if the legislature fails to act, it will cost them and other families dearly.
Right now, it's like
Nearly impossible.
It's nearly impossible. This is going to make it impossible for anybody to get any support.
But no matter how impossible it gets, they'll continue to push for a better system.
It just feels, you know, sometimes helpless and futile. But she's our daughter, and we're not giving up on her. So we will continue. We will not give up on her ever.
Now, to be clear, there is funding for mental health in both of the House and Senate omnibus bills right now. There are also policy changes that advocates tell me are also going to help, but they will continue, they say, to push for significant rate increases that up that funding for these programs that are at risk of closing. There's still time to negotiate, so we could see some rate reform, but time is running out. Both of these bills need to be off of the House and Senate floors by the end of the session when it ends next month. Live at the Capitol, Kirsten Swanson, 5 Eyewitness News.